Welcome to our Mock Interview Pro series for aspiring psychiatrists. Today, we're diving into some key questions that will help you shine in your interview and show off your skills. Let's kick things off with a scenario that tests your ability to manage challenging patient interactions. Could you tell us about a time when you successfully handled a difficult patient? This question is your chance to highlight your skills in patient interaction, particularly your communication and empathy. Here are some tips on how to craft your response. Pick a specific case that showcases your skills. Detail the strategies you apply to manage the situation. Explain the outcome and what you took away from the experience. Make sure to emphasize your communication and empathy skills. Structure your answer using the situation, action, result format. Now, let's look at an example of how you might answer this question.
In a previous role, I had a patient who often missed appointments and was resistant to treatment. I scheduled a one-on-one session to understand their concerns better, using active listening to establish rapport. By validating their feelings and involving them in their treatment planning, they became more engaged and started attending sessions regularly. This experience reinforced the power of effective communication.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for psychiatrists. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Can you share an experience where you worked with a multidisciplinary team to enhance a patient's mental health outcomes? This question is designed to assess your teamwork and collaborative skills within a multidisciplinary setting. Let's explore some pointers for your response. Briefly describe the patient and their initial condition. Explain the roles of the team members involved. Discuss specific interventions or strategies implemented. Highlight the positive outcomes for the patient. Reflect on what you learned from the experience. Here's an example answer to guide you.
In my last position, I worked with a patient dealing with severe depression. Our team, consisting of a psychologist, a social worker, and a nurse, developed a treatment plan that included therapy, medication management, and social support. This comprehensive approach led to significant improvements in the patient's mood and engagement, underscoring the value of collaboration in mental health care.
Describe a situation where you faced a conflict with a colleague about a patient's treatment. How did you resolve it? This question aims to gauge your conflict resolution skills and professionalism in difficult situations. Here are some tips to help structure your response. Remain calm and professional while explaining the conflict. Use a specific example that highlights your communication skills. Focus on how you approached the conversation and sought common ground. Emphasize that patient welfare was your priority. Mention any follow-up actions or changes made after resolution. Let's take a look at an example. Answer.
In a previous role, I disagreed with a colleague about prescribing medication for a patient. I calmly expressed my concerns in a meeting, focusing on the patient's history and potential side effects. We agreed to consult a specialist together to ensure the best care for the patient. This resolution emphasized the importance of open communication and collaboration.
How would you handle a situation where a patient refuses medication that you believe is necessary? This question tests your ability to manage treatment challenges and patient autonomy. Here are some strategies to consider. Acknowledge the patient's concerns and feelings. Explore the reasons behind their refusal in a non-confrontational manner. Educate the patient about the benefits and risks of the medication. Collaborate with the patient to develop an alternative plan if possible. Document the discussion and the patient's decision for future reference. Let's look at how you can frame your response.
I would begin by listening to the patient's reasons for refusing the medication, ensuring they feel heard. Then I would explain the benefits and address any misconceptions they might have, exploring alternatives that might be more acceptable to them. This approach respects their autonomy while prioritizing their health.
You discover a potentially serious underlying condition after a psychiatric assessment. How do you address this with the patient? This question checks your ability to handle unexpected findings with empathy and clarity. Consider these key points for your response. Prioritize a compassionate and empathetic approach. Be clear about the findings without causing panic. Explain the implications of the findings on their mental health. Discuss referral options for further medical evaluation. Encourage questions and validate the patient's feelings. Here's a sample answer to illustrate this approach.
I would sit with the patient in a comfortable environment to discuss the findings clearly, emphasizing the importance for their overall health. I would outline the steps we can take next, including referrals to specialists, ensuring they feel supported and understood throughout the process.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free, just grab it below.